My name is Wayne Masters, and I've been looking around to have the work on my mouth done. I did extensive work in my teeth. I went to several dentists and who told me they couldn't do the work, the extensive work that had to be done. I needed to reroute my whole mouth and adjust my jawbone. And I saw Dr. Weisfogel's ad in the paper, and he offered a free consultation. I came in and talked to Dr. Weisfogel. He seemed very confident in being able to help me. It wasn't inexpensive. However, I felt that the quality of life needed to be addressed, and I needed something to eat with. So I went with the work that he had to be done, and it was extensive. It took a couple of years, but I feel that it was successful, and results is fine with me. I was born with a defect in my bone structure in my teeth. I guess I was lacking something because my teeth came in pitted when I was born. So my first teeth, my second teeth just started to go no matter what I did. I could brush my teeth 3 times a day. So I've been in and out of dentists my whole life, and to make a long story short in that, I had to, the jawbone started to recede back on my mouth. And I needed an implant on that side because I couldn't chew on the left-hand side of my mouth. And I went to several dentists, and several dentists said, and oral surgeons, and said that did implants, and they said, we can't do it, it's too close to the nerve. And Dr. Weisfogel looked at it, and he said, it looks like you have a lot of whiff on your jawbone. He says, I think I can help you. Well, my life has changed since I've had the dental work done because of the fact that my smile is nicer. I don't have to worry about smiling and having a tooth fall out or a tooth missing, which we're putting in another implant, which was not on the scheduled initial estimate, but he said he would take care of anything that came up that he did not recognize as being the way to fix it. Yeah. When I met Dr. Weisfogel, and we sat down and he explained to me the amount of work that had to be done and the cost that it was going to be, I told him I would take a day to think about it and think it over. And I thought to myself, the quality of life was not going to be there if I didn't spend this kind of money. And also, nobody else wanted to take the chance. Everybody else told me there was too much of a risk. And Dr. Weisfogel took the challenge as far as the risk goes, and he said there was no worry about hitting the nerve, which would make the side of my face lopsided. So I thought to myself, I said the expense is secondary when it comes to your nerve in your mouth. And if he's very confident about doing this work, then that's why I felt I would go with him.